For many of you, ultrasounds are going to be a highlight of your pregnancy journey. It's often the first time you see your baby's heart beating, their tiny arms and legs moving, and even their first yawn. It really is such a magical experience and a moment you'll likely never forget. But ultrasounds are more than just a bonding moment. They play a crucial role in monitoring your baby's health and development. They provide important information to ensure everything is progressing as it should and can alert your healthcare team to anything that might need extra attention. And in this video, we'll talk about everything you need to know about ultrasounds, the different types you might have, what to expect during your appointments, and the benefits and risks, and some important precautions to keep in mind. Whether you're feeling excited or a little nervous about your upcoming scans, this video will give you all the information you need to feel confident and prepared. So, first of all, what is an ultrasound? To explain it simply, an ultrasound or sonogram uses high-frequency sound waves to create images of your baby in the womb. These sound waves bounce off the baby, amniotic fluid and placenta to produce a real-time image on the screen. Ultrasounds allow healthcare providers to monitor your baby's growth, position and overall well-being, and of course, they give you a sneak peek into your little one's world. Now, there are several types of ultrasounds and each serves a specific purpose. So one, you've got the dating scan, which is conducted between 8 to 14 weeks to determine how far along you are and establish your due date. 2, you've got the nuchal translucency scan. This is performed between 11 to 14 weeks to screen for chromosomal abnormalities like Down syndrome. 3, you've got your anomaly scan. So around 20 weeks, this detailed scan checks your baby's anatomy, including their heart, brain and spine. 4, your growth scan. So this is recommended later in pregnancy if there are concerns about your baby's growth, positioning or amniotic fluid levels. 5, you've got a 3D or a 4D scan. These are optional scans and can provide incredible images and videos of your baby in 3 or 4 dimensions. These are often done privately and these are more for bonding than medical purposes. Now, there are some great benefits of ultrasounds and they play a vital role in pregnancy care. Here are some of their key benefits. It's painless and you get immediate results. So they're non-invasive and provide instant feedback for both you and your healthcare team. It's a bonding experience, so seeing your baby move or even sucking their thumb can be an unforgettable moment that strengthens your emotional connection. Ultrasounds are highly effective at identifying potential concerns early and confirming the health of your pregnancy, allowing any issues to be addressed promptly. So while ultrasounds are generally safe and widely used, it's important to be aware of potential risks. A routine scan might occasionally lead to a misdiagnosis, suggesting a birth defect or issue when none actually exists. This can cause unnecessary stress for parents. Additionally, while the evidence is not definitive, some studies have explored the possibility that prolonged or repeated exposure to ultrasound energy could have subtle effects on neurological functions. Prolonged or unnecessary exposure, particularly during non-medical scans, may also carry risks. Also, if someone is untrained and they operate an ultrasound device, they might expose the baby to unsafe energy levels. This is why it's important to limit ultrasounds to those performed by qualified professionals and stick to medical necessary scans only. To ensure ultrasounds remain safe and beneficial, here are a few simple precautions to keep in mind. First, always have your ultrasounds performed by a qualified healthcare provider. A trained professional ensures the proper technique and keeps both you and your baby safe. Second, you should avoid using over-the-counter devices like those at-home fetal heartbeat monitors. These gadgets aren't regulated and they can pose unnecessary risk. And finally, if you're having an internal scan and have a latex allergy, be sure to let your sonographer know in advance so that they can use the right equipment for your needs. Now, here's what happens when you go for an ultrasound. You'll usually lie back on a bed and a gel is applied to your belly to help the ultrasound device, called a transducer, send and receive sound waves. In early pregnancy, a transvaginal scan might be used for a clearer view of the baby. So during this scan, the sonographer will measure your baby, check their heartbeat and assess the placenta and amniotic fluid levels. Each scan is different and some might feel a bit quiet while the sonographer focuses. Of course, feel free to ask questions at the end and they'll explain everything you need to know. Now, ultrasounds are often a highlight of pregnancy. Seeing your baby move, stretch, and wriggle can make the pregnancy feel more real and is such a special bonding experience. However, it's normal to feel nervous, especially if you're worried about the results, so try focus on the joy of the moment. Now, ultrasounds are incredible tools, but it's important to keep in mind that they do have their limitations. While they provide detailed information about your baby's growth, position, and development, they can't guarantee 100% accuracy for every condition. For example, measurements like your baby's estimated weight are just that, they're estimates, and they can vary quite a bit. If something unusual is spotted during a scan, try not to panic. It doesn't necessarily mean something is wrong. Further testing might be recommended to get a clearer and more accurate picture. Ultrasounds are a helpful guide, but they're just one piece of the puzzle in monitoring your pregnancy. Now, just some final thoughts on ultrasounds. They're certainly a powerful tool in pregnancy care. They provide reassurance, critical medical information, and moments of joy for you as parents-to-be. While they're considered safe, it's important to use them wisely, so stick to medically necessary scans and always have them done by a trained professional. I'd love to hear your own experiences with ultrasounds. Were you amazed when you saw your baby for the first time? Did you feel nervous before your scan? Share your stories in the comments below. I'd love to hear more about your experiences. If you found this video helpful, don't forget to like, subscribe, and share it with someone who might benefit. And before you go, make sure to subscribe to my newsletter. You'll get a free labour and birth cheat sheet and a birth preferences planner to help you feel more confident and prepared for the big day. These resources are perfect for organising your thoughts and communicating your preferences with your healthcare team. So sign up today. I've dropped a link in the description below, and I'll see you in the next video.